Obsessive-compulsive disorder, OCD, is a highly distressing anxiety-related problem affecting around 1.2% of the general population. OCD usually involves three reciprocal processes. Firstly, intrusive and recurrent negative thoughts, disturbing images or physical sensations. Secondly, obsessional thinking patterns involving intense rumination, worry or self-doubts, and thirdly, ritualistic or neutralizing behaviors, referred to as compulsions. The negative intrusive thoughts and obsessional thinking patterns are highly distressing and often repugnant to the individual. The repetitive behaviors or rituals are accepted as irrational but highly habit-forming and incredibly difficult to break. OCD can be referred to as covet, where the obsessional thoughts and compulsions are internalized as mental habits or routines, or overt, where the compulsions are externally observable and involve repetitive behaviors or rituals. Covert forms of OCD are sometimes referred to as pure O. This involves a primarily obsessional form of OCD, where it is often difficult to distinguish between the obsession and the mental ritual. OCD can be viewed on a spectrum and is clustered together with other disorders including body dysmorphic disorder and body-focused repetitive behaviors, BFRBs, which include skin picking, nail biting and hair pulling behaviors. OCD commonly occurs alongside other anxiety or mood problems including generalized anxiety disorder and depression. The different forms of obsessive-compulsive disorder. OCD is a single term given to describe a wide range of anxiety-related problems that tend to follow common cognitive and behavioral patterns. Whilst there are numerous variations on the problem, OCD will typically involve one or more of the following areas. Checking behaviors, continuously checking or testing things to minimize perceived risk or threat. This could include switches on the cooker, locking doors and windows, or repeatedly asking questions or asking for verbal reassurance. Symmetry and orderliness. This involves a compulsion to ensure that everything is lined up, in its correct place and feeling just right. This is done to maintain a sense of security and control, to prevent discomfort or sometimes to avoid worries about something bad happening. Physical, mental contamination fears. This involves extreme worries about real or magical threats such as bacteria, viruses, chemicals, bad luck, bad numbers and the names of illnesses. Sufferers become preoccupied with cleansing, avoiding possible sources of contamination and attempting to limit the potential for cross-contamination of safe areas. Hoarding. This involves compulsive collecting, difficulty discarding and problems organizing the saved or acquired items. This usually results in cramped living conditions as the hoarding habit takes over all available living space. Intrusive thinking, rumination. This involves the continuous recurrence of personally repugnant and disturbing thoughts, images or impulses that are highly distressing and often relate to violence, sexuality, morality, danger, or acting in an unacceptable manner. How OCD is treated using cognitive behavioral therapy. Contemporary psychological research shows that OCD can be effectively treated using a number of different cognitive and behavioral strategies. These techniques involve altering negative self-appraisals, normalizing and diffusing from intrusive thoughts and obsessions, and minimizing compulsions using ERP to promote habituation and inhibitory learning. Obsessive-compulsive disorder is treated using cognitive behavioral therapy and/or serotonergic medication. SSRI medication plus CBT is the recommended choice of treatment for OCD. Effective CBT strategies include exposure response prevention, ERP, cognitive therapy, CT, acceptance and commitment therapy, ACT, and inference-based therapy, IBT.